In this series, I will invite one woman at a time to talk about her journey, her path to mental health, wellness, fulfillment and success here in the UAE. This is Feminine Power, UAE edition. This is Feminine Power and I am Dr. Ola. Very honored to meet today Dr. Helena Taylor. And Dr. Helena Taylor is the best gynecologist in Dubai. I say it wholeheartedly. It's not just that you're the best doctor, Dr. Helena, but I think it's a very rare combination of high professionalism and also very humane approach. This is where the brain and the heart meets, and that's why you are so loved. That's why Dr. Helena is so loved by so many women. So welcome, Dr. Helena.
Thank you so much, Olga. Thank you for the introduction.
Okay, Dr. Helena, I am really honored to have you with me today. And really, I have so many questions for you. But first and foremost, how do you do it? How are you so professional, and how does your mind doesn't take you away from your heart? Because sitting in your room when you see a patient, and I know this because I was a patient, Dr. Helena, you know, you delivered both of my children, so I walked the full journeys with you. I still felt as a patient that you think you are of course very medically aware and present, but at the same time there's such a big heart. How do you combine the two?
I think, Ola, as you said, sometimes as doctors we forget that we are human, and you have a human being in front of you who needs not only the medical attention, but also what's happening behind the medical attention. Before we started recording, you were talking about when somebody comes with anxiety, what's behind it? And in women, unfortunately, or fortunately, a lot of women who come and they have health issues. Yes, there might be a health issue, but also there is something behind it. And I have to listen behind the words. What is it reflecting? What is it telling me? And I see that day in and day out. Also, as a human being, I don't want myself or my family to be with a doctor who is not looking at that person, whether it's my husband or my son or my granddaughter. I want them to see the human in them rather than that piece of meat sitting with a disease. And I don't want that for me, for my family, or anybody in front of me. I do it, but I know sometimes I fail, but we have to learn. What can you do?
I mean, I know you're doing it beautifully, right? I know you're doing it because really the person feels seen in your presence. You know, like I was thinking the other day, I know women come for you to help them deliver. So technically it's about the baby. You are helping them to deliver the baby. But when you sit in the room, like when I sit in the room with you as a patient, I feel actually that it's all about me. Suddenly, you know, like, of course it's about my baby, but I am seen, I am heard. So it's a beautiful value, and it's evident, it's there, you know, it's felt. How did you come to this value? Where did it come from for you? Why is it important?
It is important because having the baby is the end journey. It is just the last dot in that chapter. It is what you work, what you do to get to that result. Like, you know, like now I have a lady who's in labor. I think over the last 4 weeks, I've seen her about 5 times, 6 times, talking about her anxiety about the delivery, what's going to happen, addressing these things when we know she's going to go through a journey which is full of fear, especially sometimes with social media or negative people around you. They're going to talk about, you know, when I delivered my baby, I had this, I had that, I had a complication. And people focus on the negative and they forget about the 99.9% of women who have really nothing, and I want them to enjoy the journey. So getting to the end result, it's a work of 9 months and sometimes more than that.
Right.
So it's just remembering we wanted to have a safe birth, to have a beautiful delivery, to bring that soul to a happy place rather than to the negativity.
Gosh, I love it because it's the mindset, it's the psychological environment that you are bringing the baby into, right? Do you see the difference in how pregnancies goes based on the mindset, or it's not really related?
100% it's related on that. And I see that women who are, probably you see it as well, you see the family when they are positive, easygoing, things flow smoother. When there's anxiety, it is, I don't know how to say it, and we're talking about it beforehand, like some people, they come in and they have a baggage with them. What did the mum give them? What the society gave them? How they've been judged? How about everything from their weight gain till the managing the pregnancy. Don't do it this way. Do it that way. You can see that. You can see that in the woman coming through. Unfortunately, sometimes we can help them. Sometimes they're not ready to be helped. You have to wait.
Yeah, you have to wait, and because it's about readiness and willingness, right? Everyone has the past, but how you deal with that, how you address all those things, I guess it's again based on your internal state and where you are in your life.
Exactly. Some women are ready to move, some are not. Some are not, and we see that. We see that day in and day out. But there's nothing, I can guide them, I can tell them, but if they don't want to do it, they can't do it, unfortunately.
Yeah, I mean, for good gynecologist, for an excellent, amazing gynecologist like you, I feel there's a big part of being psychologist inbuilt in it somehow by default. And it's the natural ability to connect, to help the person open up, because many women who come to you, they just talk about what happens in their life, not necessarily related to the pregnancy and physical state of things.
Very true.
How do you deal with so much information? Don't you feel it reflects on your well-being also?
Oh God, you should have seen me yesterday. You'll say that's not the same person. It does. And I would be lying if I tell you it doesn't affect. It does affect me. I divide my day into 2 parts and try to separate them completely. I'd always, with every patient they come, I listen. I really try to listen. For example, women have a pap smear and the pap smear comes abnormal, okay? And they know that's HPV infection. It's not the disease, it's what's reflecting that disease. I need to navigate it carefully, clearly, and also be cautious of what I'm saying. But also I know that our patients are, thank God, touch wood, they are really educated, especially in Dubai. I don't know how it is in other countries. I'm not talking about the Emirates, but because that's my area here. Women are so educated, they read a lot, And you know, when they come with an abnormal smear and HPV infection, what does that reflect? I know she's thinking, is there any extra relationship happening? Is there any mistrust between her and the husband? What's going through her mindset? And I usually tackle this first, because the disease, we can control it, we can deal with it, but this patient's life should not be ruined, or her marriage should be ruined by that. This is an example, so I need to tackle it. I'm always upfront with them. And one patient said to me, no, I'm not thinking about it, doctor. I know you're thinking about it.
Right at the back of your head, it still will pop up.
It's gonna pop up. Or if they have endometriosis, okay. Oh, doctor, I have endometriosis. What am I supposed to do? What shall I do? How can I get rid of it? But again, what is the problem? What you're suffering from? Is it the pain? Is it the heavy period, the painful period? What is the issue? What do you want? All women, every patient in this country have polycystic ovary, but what is your problem? Listen to what they're trying to tell you, and that is the hardest bit. Sometimes I can do it. Sometimes you feel there's much more into it, and you can source that also from just listening to the patient.
How did you learn to do it? I mean, I'm sure a medical school doesn't have, you know, classes on how to help the patient psychologically. Or do they do? Maybe I'm wrong. How to connect, how with your patient, how to guide them psychologically.
Definitely in medical school, they don't teach you this. They don't teach you how to, they teach you to listen, to be passionate about your job, love your patient,
Yes.
listen to them, but they don't tell you how to do
Right,
it.
the skills.
The skills, or how to set up your business. Like,
Yes, it's a big one.
It's a massive one,
Right.
because they don't teach us, and in Europe they don't have
Yes.
that. In the States, it's probably, yes, it is present more than. Before I went to medical school, my dad was a physician, and he was pushing me to do medicine, as the Arabs do. They know you're a doctor, you have to be a doctor. It wasn't in me till a friend of mine said, I'll never forget that guy. He said to me, if you love caring for your patient, do medicine. And I thought, yeah, that's what I want. I want to help them. I don't want to be a doctor. I want to be the person who helps them. And I think that's what it is. And then as you grow and mature, you start to find your way around it all.
Yeah, but you know, it sounds, again, very beautiful, because, okay, maybe medicine wasn't the original passion, let's say, yeah? But then you find your way somehow in whatever profession you are, to have that soul calling manifested and that purpose caring in your case, right? So you brought it. It's actually you who brought it to that profession, because it was inside you.
I really don't know, but I feel it with the patient, or like small things make me attached to the patient. Sometimes they come in and they hug, and I feel, yes, that's love.
Yes.
And I'm there as a friend who's going to help them, rather than that screen. You're a doctor and that's a patient, and you have to deal with them. Small little things. I'm grateful. I'm grateful to everyone who comes through my door, whether I could help them or I failed to help them. But I'm grateful. I learn from them. You learn from women, from their journey, from the hardship they go through. We do, you do as well.
Yeah, absolutely. It's two-way street, right?
Exactly.
Whoever we support, I feel they shape us in a certain way.
100%.
Yeah.
100%.
Who did you want to be if you didn't want to be a doctor?
I wanted to be an architect.
An architect. That's interesting, but there's also very different.
It is.
As in, you mentioned caring, right? And I'm just curious about, where's interest for architecture? What did you like about it?
Just like when I came to your office, and I look like how nice the place is, how the energy in it. It is the minute you pass the door, like, hit me positive energy. It is true. It is true. It is. I don't think it's the light or the building, but you can feel it, and that's what I wanted. Or maybe because I wanted to rebel against my dad and not do medicine.
We've all been there, right?
Just to prove him wrong.
Do you think he would have accepted if you tried to go that path and rebel?
I think he would, yeah, bless him.
Yeah. You know, I hear this architecture, it's, again, environment. You're shaping the environment, you're creating the beauty. It's about creation. And while architecture is, you know, you're shaping the environment physically, now what you do with women, you're shaping the environment emotionally.
Thank you, that's very nice.
This is, you know, that creative power, that desire for that beautiful surrounding around, and positive energy, as you're saying, yeah?
It is it might be the same thing. It's just you're going around and you're achieving the same thing in a different way, I presume.
How was the medicine? I mean, how many years you had to study? I'm sure it's a long journey.
Well, medicine is 6 years back in Syria, but then I moved from Syria to England, and you work and you learn and you work and you learn. And in the days when I trained, we didn't have a 40-hour week. You work and work and work, and sometimes you get to 100-hour a week. So you're working and learning, and you are shaped by the people around you as well. You know, people who stepped into your life, how much they taught you. If someone asked me, would I go back and change anything, I wouldn't. No, nothing at all. I loved every bit of it, the hardship and the goodship.
Gosh, this is again what makes you so beautiful. You know, I feel you take the challenges and you just learn from it, and you make it part of the dance, and you just keep going with this, you know. If we were to think of people who you feel shaped you the most, who would come to mind?
Oh God, a lot, I think.
Yeah?
I think as person, probably my dad more than anybody else. I liked his passion, the way he helped people. My kids as well, my husband, they teach us, they shape us in a different way, even when they were little till now. Work-wise, there's a lot of people who really helped me, and I'm grateful to every one of them, really a lot of them.
What's the greatest lesson you feel you've learned so far?
Wow, that is deep. Well, I need a psychiatrist to help me with that. We're all human. just in different clothes, different challenges, and we just need to go deep into that person's soul and help them. Because we're there to help, we're there to serve. And as I'm helping them, someone will come my way and help me in my journey as well. And that's how I feel it.
Yeah, and this is that connection I always sense from you, you know, it's that sense to connect, and it's that gentle grace as you're connecting with people. This is, I feel that this is what you're talking about when you describe these things.
But no one does it much better than you. I remember you sent me on 2 occasions WhatsApp messages, and I went there, here, and this beautiful yellow flowers, because you love yellow flowers. And I thought, that's her. You know.
Yeah, because I still feel we're connected somehow, you know. I don't think you also realize how impactful my journey with you was.
I think I do.
Yeah.
I think the first time I saw you, like,
yeah,
doubled up.
Yeah, and you know, I remember when you met me first, you came out of your room and you shook my hand. And I think this matters a lot, because and I don't know whether it was just me, whether it happened in the corridor, it's like how it works nowadays, but I feel it makes it very personalized, like I felt you met me, you know. So for you, right, so many women, so many journeys. How many kids, by the way, have you delivered? Do you have an estimate?
I really don't know. I really don't know. I don't count. Because they're not numbers, they're human, and they're beautiful. A lot.
Yeah. And when you had your babies, how was your pregnancy, if you allow me to go a little bit there?
Oh God. Again, in the days when I was pregnant, we didn't have that support, and you want to do it on your own. You want to prove to your family you can do it. You're
strong, you're the woman.
Yeah, we can do it. And also I think that probably shaped me as well to be who I am now. So the pregnancies were fairly easy, and the delivery wasn't bad. It's just, what did I do to myself? I was single yesterday, no worries in the world, and now I've got 2. What am I supposed to do with them? How are you supposed to deal with them? What are you supposed to say to them? It's a big challenge, challenge.
It's a lot of pressure for women also. I think no one tells us, no one prepares, you know, this is how it's going to be. And I think if you try to explain it to someone, I don't think they will understand, because first you need to walk that path to understand what it really involves to have your nervous system there 24/7. And then everyone's journey is different also, right? It will be different. So between your kids, how many years difference?
There's 3 years difference between the eldest and the second one. I'm really proud of them both, because they're both clever, and despite, you know, in the UK you're on call every 3-4 days and you have one full weekend to work, and they really helped me to keep my job going and being good boys, bless them, both of them. So they helped in that way. They shaped my journey in that way. But also as they're growing and I see the challenges in them, I can relate to women when they have a baby, what it means. I remember I delivered a lady and she had a beautiful pregnancy, beautiful delivery, and I remember she came at the 6-week checkup and she says, put something on my throat. You prepared me for everything, but not for the baby. And I thought, true. You don't know how to deal with it. You don't know what you're supposed to do.
But that's why what I love in your clinic, that you have different branches, right? So you have someone to help you with physiotherapy. So obviously it's a big thing also 100%. After giving birth, right? The shape, and not just the shape, it's not about beauty, but the muscles and the health, right? And then big question about beauty, and so you have dermatologists, and like there's, I feel you are tackling is not the right word, you supporting the woman from all different angles.
Yeah, that is true. We try. And as you said, we don't give enough credit to the osteopathy and the physiotherapy, whether during the pregnancy or after. And yes, you said the word shape, and it is, I know you don't want to talk about shape, but this is an important issue for women, because they lose their identity. You're 100%. Not Helena anymore. 100%. You're the one who's pregnant and you feel like a whale and you cannot move. And that does affect you. We cannot deny that. And so yes, seeing the osteopath and the physio does help them, bless them, to be in control of their body, how to react, how
Exactly.
to get back into shape as quickly as they can without compromising their health. We have an adult psychologist. So you have the postpartum blues and the depression, but sometimes it doesn't happen till 6 months or 12 months later.
With the second child, I feel
Yeah,
the
exactly.
second
Why is
experience.
that?
So I think the nervous system is more. So say, imagine if something happens, all the resources are activated to support you,
Yeah.
and then how long can you last?
Yeah.
And then the resources, internal resources, are getting exhausted. So, and that's usually 6 months. With the second baby, there is even more pressure, right? So it's not just you and the baby anymore. It's another child, and there's a husband, and there's career for many women, and it just becomes too much, I guess.
And also how to tackle the first child.
Yeah.
A lot of women, they feel guilty of having a child. I mean,
Yeah.
why? Oh, because I'm not going to love the first one, or I'm going to deal with the first one.
Yes.
This is a big, big thing.
Big thing.
Yeah.
Have you ever thought, like, once you had your children, have you ever thought career or children? Have you ever considered you're gonna be a stay-at-home mom or working mom? Or
I did, and I remember I took a few months off, but as much as I enjoyed my kids, there's the other part of me. It's not only the mother, it's that person who want to continue. Yeah, I won't deny a lot of times I think, like, I don't want to work, I want to spend time with my family, but then you go back.
Yes, and you know what I hear quite often is that women who are passionate about career, I hear a lot of ideas that it's about achievement and that, you know, you want to prove something to someone. But then I challenge that, because I feel it's not always about proving something to someone. It's sometimes it's just about passion and joy and having, as you said, that part of your own identity. Who am I in all of this?
Yeah. And that's why you set up this job. That's the Wellness Hub is to make it a rounded, complete services for the children, isn't it? It's nothing to do. You don't need to prove to anybody anything. You need to prove it to yourself that I'm helping that person in every way I can.
Exactly, it's that service also. And I feel like if God blessed us with a gift, with a skill, I feel it's very, I wouldn't say wrong, but it's sad for me just to keep that music inside. Like, I feel like we want to spread it and share impact, you know, because someone might benefit from it.
That is so true. That is very true. And definitely somebody will benefit. You may not be able to benefit everybody, but a lot of people, they will say, thank you, you've helped me somehow. And you see that in your work here.
Yeah. When you felt that, okay, this is part of my identity, I still want to do what I like doing, how did the family respond? Like, people were supportive, and we're talking about, I guess, some time ago. I'm just curious if anything's changed in people's mentality around us in seeing a woman.
Definitely the mentality has changed, whether it's in Europe or in the Middle East. Women are stronger, they're independent, they know what they want, they go and get it, and we see that. I would say 80% of my patients are working women. Most of them, they fly on regular basis on business trips. So you can see they're determined. They are good mothers, they're good wives, but also they are good at their jobs. And most of them, they are in high flyer jobs. They are very confident. I mean, that's why I tell them, I learn from them. I learn from these women. So definitely society now is different to what it was before. Although we don't like social media, we don't like TikTok and things like that. But you can see women are succeeding, and we just need to support each other and continue.
Yeah, I like this support, you know, even women supporting women. Yeah, are there any women in your life that you feel, okay, this is my tribe, these are my women who I can be with myself?
Yeah. You'll have that one or two persons in your life you think, that's my go back there.
Yeah, that's my go back person. And I think it's also, once you have that person, if you stay in touch over the years, it's also beautiful to watch how that relationship grows, flourishes, goes through stages.
That is true. And if you have someone like that, you should always hold on to them. They don't come that often, but when they come, they come
Yeah.
for a reason.
Yeah. Why UAE? Why did you shift to UAE? Because you were in the UK, right? So Syria first, then you went to the UK, then you've come here.
Again, you know that person you told me about, who that my friend, my go-to.
Yeah.
She's the person who said, "Why don't you try here?" I said, "I've never worked in the Middle East." Well, give it a go, and then
Right.
and I'm blessed with a husband who's very supportive, as you
Yes.
are. And he said, "Let's, give it a go," because we are on the way to Australia. I've got family in Australia.
Right.
I said, "Give it a go. What would you lose?"
Yeah.
And I never looked back. Never looked back. I would never imagine my life to be that better.
Yeah.
I'm talking better at every level. Ola. I'm talking about physically, emotionally, mentally. It's just a different life. In Europe, you work just to survive. Here, you work to live.
Yeah.
You work hard and you play hard, but you work and you enjoy your life. And that's the difference.
Yeah. So UAE is home now.
100%.
How many years now, Dr. Helena?
I came in 2008.
Okay. Yeah.
What about you? When did you come to
I came 2015, I think.
And I think after what they call it the war, I don't know, for me it's not a war, it was firework,
Yeah.
I felt more home than any time in my life. I felt so protective for the country.
Yeah.
I hated anyone who said a bad thing, and the
Yes.
people who left leave.
Yes.
You don't need to,
I hear
nobody
you.
needs to come back.
I hear you. Yeah.
This country gave you a lot. You can't just turn your back on it. And since the war, I felt more attached, more rooted, deeply rooted. Funnily enough, my husband, who's Irish more than, and he feels the same thing. And when he goes, he just want to come back home.
Yeah.
Which is amazing.
Yeah, that's beautiful. Also, I think that experience, again, transformed the land a little bit, because people kind of had an opportunity to know what they truly feel about the place, right? Like for us, it was very similar. I mean, this is home, and everyone has their own circumstances. I know some people left, then came back, some people left, never came back, and everyone has their own path, their story. But for us, it was the same. This is home. And when I saw your videos, I loved it. You had the T-shirt with the UAE. Yes, and the number, I think. And then
it's
there were
the UAE to stay.
Yeah, yes, exactly. And there were so many different things that, you could feel this is home. What did UAE give you in 3 words?
In 3 words?
Yes.
That's not fair.
Okay,
That's
come
not
on.
fair. Sense of being,
Yeah,
the love,
yeah,
and appreciation.
yeah. This is more than,
I remember I went when it was, again, during the war, I was running to the hospital to deliver a patient, and as I came after the delivery, there was something happening in the sky. And I said to my husband, I said, "Oh my God, it's really hard to look after the patient and the baby." And he said, "And he's in the sky looking after all of us." And I thought, wow, so powerful.
Yeah.
Like, we didn't appreciate what this country had done to protect us. We're not their kid. We're not Emirati, and they did that.
Yes, yeah.
We should appreciate.
Again, there is a lot of connection, and there was a lot of unity. Yeah, this is how we experienced also.
Did you?
This was a lot of unity in there. Yeah.
And not for a minute I felt unsafe.
Yeah.
Not for 1 second.
Yes.
Not for 1 second I felt unsafe.
Yes. And we were discussing this, and we were saying, I think the UAE is the only country when it's the war and you find people in Antara having drinks and taking advantage of, all these offers and all of that. I mean, I don't think anywhere in the world this could have been possible. And it was so smooth. And
it was. But also, unfortunately, the West media made it really bad. Because I'll be at work or being out for dinner, and my son goes, "Mom, what's wrong with you? What's happening there?"
Because he was calling from
England, and he doesn't just hear the bad news. And we'll be having a drink. I would like, "Are you serious? Have you lost your brain?" I said, "But there's nothing happening."
Yeah. Well, our experience from within was very different.
It's very different to the outside.
Yes, absolutely. So with all this, skills, with medical knowledge, you've come here, you already were the doctor. How did you have courage to open your own clinic?
Can't say much. When I first came, I worked in a different with a hospital, and I was happy there, but I felt I was there to do a job. It's about quantity,
Right.
not quality.
Yeah.
Just seeing patients and numbers, and you were judged by that. And I got to a stage I felt like this is not me, this is not for me, and I had to just put a full stop and change. And I know when I left that place, I didn't have a clear idea what I'm doing,
Yes.
but I knew that I had to leave because
Yeah.
I'm losing my soul in
Yes.
that place. And
Gosh,
never
you
looked back.
listened to that voice in you and you acted on it, and you didn't
Yeah.
know what exactly is going to happen, as no one else knows.
I promise you, I read the Bible and the Quran 5
Yeah.
times before I've opened
Yeah.
the clinic, because I know if I'm going to see a
Yes,
patient in
yes.
my life.
Yeah.
But I
Yeah.
took the plug and went
Yeah.
for it
Yeah.
and never looked back.
Yeah,
Never
I
looked
can, I
back.
can tell, because I also hear from you, you have your own vision of how you would like care to look, how you would like to support women, right? And you, again, created your environment, architect in a way.
Thank you. Yeah, because the supporting woman is not the pregnancy, is it? It's before and
Yeah.
after and during
Yeah.
and what comes with it. And that's what I wanted.
And that's little things, how the nurse talks to you, how the receptionist handles your paperwork, what time is the appointment, and when you're actually seeing the doctor, how the doctor calls you, you know, and delivers the news. It's like, it's these little things that I feel make the full picture of that care. Yeah, but I'm sure the journey, probably I'm assuming the journey is not smooth, because I reflect on how we opened, and every day there's something coming up, and every day we just dealing with something new. And I would love to learn from you if there is anything that you would feel comfortable sharing, like any skill, any thoughts, any feelings, like how do you do this? You're very successful, Dr. Helena.
I thank you so much. I don't deserve all of that.
You
I know.
do.
Thank you.
Certainly do.
The thing with opening your new center, I divide it into 2 parts. You have the patient part and the work, the place. I remember on the first day we've opened, although you know when you open you check everything in place. On the first day we opened, it was a Thursday, I'll never forget it. By midday there was 5 disasters in the clinic. 5. One of the patient chairs, which we paid a fortune for it went up, didn't come down, the computer stopped working, the scan machine, which was 500,000 dirham, burned in, and I nearly collapsed.
Yeah.
Then I thought, like, stop,
Yeah.
take a breath and solve one problem at a time.
Yeah.
And you're going to see that day in and day out, whether it's a leaking sink or a complaint or inspections or things like that, but you have to take it day by day. And I leave that to people to manage it, because I don't know how to deal with it. Actually, I taught myself to how to not to deal with it, because I was a control freak. I want to do everything myself, but I let go with that. And then just focus on the patient, keep the patient we have, keep them happy, look after them, and how to attract more. And that's what we were about.
How did you let go of it? What helped? Because I sometimes find myself also into, okay, I need to check this, I need to check that. It's always like I have to check and make sure, but you cannot check and make sure for everything.
No.
How do you let go?
I think I was lucky I had 4 nurses who started with me from 2014 till now, and I think they shaped me, or they helped me to let go.
Right.
Like, oh, the appointment, do it this way. Leave it to us, we'll sort the appointment. You do your job, we can do that. This one has an issue, we'll deal with it. If we're stuck, we'll come to you. And I think that is 2 ways. So I wanted to interfere, but they were stopping me to interfere, and then I started to let go.
So it's trust. If it's a sense of trust, and especially not blind trust, but if you hire the person, if you know that they are capable, might as well let them do their job. In a way.
That is true. It's true. From the receptionist, from the minute they say hi, good morning, till the patient's leaving the clinic.
Yeah, absolutely. And this, what you were describing, you know, when things don't go to plan, when everything collapses, I feel it's like the universe wants to check our intentions also. Are you sure you're gonna do this?
You think so?
I don't know, sometimes I feel like that. Or maybe I read too much into it. But I think what you said is about stopping whatever is going on emotionally and problem solving. Right.
And yeah, I have a pause.
Yeah.
You must have had some cases like
Oh,
this.
yes. Absolutely. And I feel it's like, for me at least, it's when, as you said, first day or something important. I don't know why on the most important occasions things have to start breaking, or something has to come in place in it. What internal skills do you think we need to manage this on daily basis?
Just the love and the passion. Just the love and passion. And you're a strong-minded person. We know that. I know that. You know that. When you have the love for what you do, and the willing and the wanting, you can do it. You can do it. I'm learning more and more that everything we face in life, it happens for a reason. About a year and a half, I delivered a patient, lovely Syrian lady. She had a beautiful, beautiful delivery, nothing whatsoever. After the delivery, she had a very big bleed. When I say big, she bled a lot. It took us about 6-7 hours trying to stop the bleeding. Eventually, we've managed to stop, but by then she lost a lot of blood. And she kept all through this journey a happy face, checking on me, how I doing. Even there's blood on the floor like an ocean. After the delivery, so during the process, we were looking for an instrument which was not available, and it's hardly available. You know, you have to find it. Eventually, her husband managed to get it for the hospital. Anyway, she delivered, and the following day delivered, and the bleeding stopped, and she was fine. The following day, came to see her. What she said to me, God wanted me to bleed. So we know that this instrument is not available, so I can buy it and get it for the hospital. And I thought, oh my God, this woman, look at her attitude. Look at that. Although she had about 5 liters of blood transfused to her. And her attitude, that was a blessing, because I'm going to help somebody else. How can I not learn from, how can I not love a person like that?
But I think it's also, this is so powerful what you're saying, because this shapes our experiences in life. So you can go through the same situation and then come out of it cursing everyone and everything. And maybe I would even understand why, because you are suffering and you're not well. Or somehow internally you can make that shift and truly see the blessing, or give it meaning. I don't know, which it would not change your experience in hospital, but it would change your internal experience of what you've been through.
100%.
Right.
And that is the trick. How can I make a patient see that? Because sometimes we have this culture, I did something wrong, that's why I had a miscarriage. The doctor did this, that's why I had a bleed. They're all, but sometimes it's nothing to do with you or with the doctor. Things happen. How can I make my patient see that? That is the bit, it is hard, and that comes from within. You know, the belief.
It's the belief, right? Because this is ultimately one belief adds up to the full belief system. And that's what we know, again, from CBT, cognitive behavioral therapy. You have a belief, you have a thought, then you have a feeling, because you're reacting to your thought. And then that feeling results into a certain action, right? So thoughts are still so important.
That's so true. That's so true.
And especially being aware of these thoughts and use them. This is where I love it. You know, we all have past. I mean, people will tell us, no, but because of what happened to us, we have certain belief system, we experience certain things. Yeah, agree. But how long can we go back and blame parents? Not blame, hold them responsible for how we are in the now. I feel in our adulthood there should be time when you say, okay, this is what happened. From now on, I take responsibility for this, and this is what I choose. This is a little bit of conscious living. And I think this is what you're trying to bring to your patient also. See, you have an option here. You don't have an option of what's happening to your body, but you can choose how you respond to it, and maybe see a blessing and change your internal experience at least.
Yeah, that's a new thing, to blame their parents for everything, but you forget, like, I know my mom did her best at that time with what she had, and the same thing for my dad. I did the same thing with my kids, and I'm sure they're doing the same thing with their kids. And we just learn. But you know, you will have the odd bad parents, but usually they all try to help. as much as they know and they can do. So stop blaming and move on, you know. Learn from them. If they did something wrong, don't do it to somebody else.
Right.
Just pass the good.
Right. Again, the learning, again, sort what you've been through, take what serves you and leave what's just there, right? Just keep going.
Keep going, especially you have an Almighty looking after all of us, and He's in each one of us, and we just need to connect and see the beauty in that, and try to help and support, not judge, as much as we can. I mean,
and this is hard, because I think especially in your profession, people judge, right? Because like, if I have a doctor, so it's doctor's fault. Whatever happens, it's always doctor's fault. And as you said, sometimes is even with medicine, you're a live organism, you cannot predict everything. How do you deal with judgment? Do you feel
that is the really hardest thing for me, especially when you feel, when I know I put my heart in it, I've done everything I can to the best of my knowledge. Nobody want to go out and do harm. Nobody. Doesn't matter how good I am or how bad I am or nasty I am. No one will go, I'm going to go and hurt Ola today. Nobody does it. So when you do your best and still people judging you that I had this infection because of you, or something went wrong because of you, it happens. It happens.
If you could give a message to your younger self, because I'm thinking many women are watching who perhaps, going through different times in their life. Maybe they are envisioning something, like for me, for example, you are my model for your clinic and for everything you do. So for women like myself, or for your younger self, maybe you had, some challenge in the past. What kind of message could you give? What kind of a piece of advice, a tip?
Trust yourself, keep going, and don't lose focus. Everything comes in your life, it comes for a reason. Nobody is trying to destroy me. I'm going to learn from what life is giving me. Just keep doing it, and never give up. Never give up.
So beautiful. Trust, that connection to self. You see, you connect so much with other women, but for me it sounds like you have very strong connection to self. You listen to self, and then you go, even if it's unknown, even if it's unpredictable, even if it's scary. You go.
You go, because if I don't go, what I'm gonna do? I'm gonna be still in that place, just seeing numbers, not human. And I know how miserable I was, how unhappy I was, how I used to wake up in the morning, I didn't want to step out of the house to go to see my patients. Now, no. Sometimes I feel tired, I don't want to work, I want to rest, I want to go to the gym rather than be in the clinic. But I never step in the clinic. I'm not happy to be there. I don't see a name, I can't wait to see her. You learn. You tell me I'm a good person. I'm good because of them. I'm good because of the women in my life. Whether it is my mum or my sisters or my patient, you learn a lot from them.
Yeah, and they learn a lot from you also. They truly do.
I hope so.
How you remain so humble with all of this.
That is true, Ola. Honestly, I've seen stories in my life. I had a patient who had a massive scar here. I said, what's that? She said, I donated half of my liver to my sister. What? You gave half of your liver to your sister? Things like that. That is love, that is giving. Or this patient who lost so much blood. It was God wanting her to have this so she can help somebody else. I'm the one who's learning. I'm the one who's blessed.
Yeah, there's lots of love.
Yeah. Most of the time, sometimes not.
Most of the time. Most of the time. Okay, last one. Any practical tips that you could give to maybe women who are pregnant, or like from your experience, you met so many women. If you were to curate some kind of, I don't want again to call it formula, it will be different for everyone, but some kind of guidelines. What supports mental well-being, wellness, pregnancies as women go through this journey? What you've seen?
It's a very nice question, Ola, because a lot of women, they focus on the pregnancy, the tummy getting bigger, the physical part of it. But they don't talk about their challenge, the emotional challenge they go through it. And as I said, I told you beforehand, like, you see women who are not coping in pregnancy. And I know this is a red flag. This lady, I will put it, watch for postpartum depression, and also how her relationship with her child will be. There's sometimes a lot of resentment, a lot of anger, a lot of what have I done this for? Always ask the patient how you are doing, how things are with you. Not only physically, how are you doing emotionally? And not forget the emotional part of it. Don't take it out of the equation. It is as important, if not more, than the physical pregnancy progress. Especially if you deliver, you're in a good state of mind, you can cope better in the postnatal period.
Yeah.
Do you not think so?
Absolutely, absolutely. Of course, again, it's back to internal experience, right? So anything can go around you, inside you, with your body, but how you perceive these things and what you actually do, you know. I feel it's also how you choose, what you choose to think, what you choose to feel, just not necessarily go on autopilot all the time with whatever is coming. Not everything that's coming is true. Not everything that is coming needs to stay there. So I like, as you were saying, sorting things from wherever we are and internally also, externally and internally. What's success for you, Dr. Helena?
Helping somebody who needs, receiving a thank you card, that for me is priceless. That's for me what success is. I'll talk about professional. Raising 2 boys to be good men is a success.
Gosh.
I think so.
That's a big one.
Well, if you ask them, they'll say no. Try to be a good wife, try to be a good human. I think that's success, but professionally is when a patient says thank you or you solve a problem for her. For me, that is priceless. That is priceless. Absolutely. What about you?
For me, I just want to mention one thing. I see success, it's like fulfillment. I need to be happy in what I'm doing. That soul has to be satisfied with it. But it's also, for me, success is about making that little extra or giving little extra something that's not necessarily needed in the moment. I'll give you an example. Just before I had the surgery with you, when they were preparing me for anesthesia, my husband wasn't there yet, so they asked him to wait. And I was sitting, I was shaking, I was so scared. And you came and you did this. And that's, for me, captures the success.
Oh, thank you. But that's what you need the person, doesn't it? It is that moment when the patient is so vulnerable. You have a lot of fear. You're going through that journey with a huge amount of fear. It doesn't matter how much I can reassure you, it doesn't matter how much you read, you know there's something happening there.
Absolutely.
And trusting that person must be a big thing.
So connection, sorting things that we don't want to take with us, trusting them ourselves, not being scared of the unknown, just moving through, because what else is there to do? We'll be stuck there anyway. I hear from you trusting people around us also, at least in our jobs and where we are support systems, and that internal state of mind, that positivity, that hope, that faith in self, people, and everyone around us.
And it's not easy to always to keep it. You have to work on yourself to keep it, and whatever means helps you to do it, whether it is talking to a friend, going for a run, playing a game, watching TV, whatever it is, whatever helps that light going, don't dim it.
That light, don't dim it. And this is Dr. Helena Taylor.
Thank you so much, Ola.
Thank you.
Thank you for having me.
Thank you. Thank you for coming.